So, first, as it's International Overdose Awareness Day, I just wanted to take a moment of silence to kind of ponder that and its relationship to what our community hopes to accomplish and what is a commission we hope to accomplish. So just take a few moments. Okay. And just as a reminder, this is my second time leading a meeting, so please let me know if I do anything wrong. First things first, we need to approve the minutes from our previous meeting, which were in the notice of public meeting. Did anybody have any feedback or updates for the minutes? And I will move to approve the minutes. I second that. Amanda's for the second. Okay. And since we do have a large group today, just a few action items we're gonna follow up on. First thing, I'm just gonna say everybody's name, so everybody who's visiting knows who is at the table. First, we have Amanda Chandler. We have DJ Walsh. We have Candy Kelch. I am Jane Stormer. We have Dr. Scott Murphy. We have David Bramer. And we have Tamika Livers. Just some of the follow-ups on action items from our previous meeting. Our main action item was very successful, which was to let people know that we are going to be discussing a YMCA type facility tonight. At this meeting, we have a bullet point specifically for that a little later on. But some other things that we do need to follow up on just for our own business as a commission. In our last meeting, we talked about dates for listening sessions in our community, specifically for the BIPOC and the LGBTQI plus communities. One thing that we need to do as a commission is break down into subcommittees to have these events. And then our subcommittees will report back on these events. And there's a few other things that we might try to assign ourselves to go to this month that kind of pertain to the commission's interests. So I'm gonna look for volunteers for the October 3rd BIPOC listening session. Would anyone specifically like to volunteer for that? I can do that. Okay. In fact, maybe here. I have been doing a little bit of work on that. Okay. So I was gonna say that I followed up with Shirley Klepper, just to make sure she was aware that it was gonna happen. And she offered the second floor of Eggleston as a space. Does that seem appropriate to everybody? I think my only concern is it's not very accessible. There's no elevators in that building. But if it's an issue, we can kind of work it out as we're there. Or maybe have a second session if need be that comes up. We have Tammy. And I assume it'll be at 6 o'clock as most of meetings happen. Anybody else? I'm gonna be on both subcommittees more than likely. And for the LGBTQI plus committee, Amanda. And that one's gonna be on October 12th. I reached out to Erika Beavers with P-Flag and they offered their youth meeting space, which is a church in downtown Madison. I'll get you the details on that. Let me see if I can pull it up.
And that one's also at 6 o'clock, is that correct?
All right, yes, it's in the Fellowship Hall, behind Christ Episcopal Church at 506 Mulberry Street in downtown Madison. Anybody have any issues with that space?
No, I can take call for you, Amanda.
Thanks. All right. All right, so we have. Anybody else want to do either of the listening groups?
Can we come to both? Like,
Yeah.
okay.
Yeah, you're welcome to come to either.
Yeah, maybe I'll. Can't commit to them.
Okay. All right. So we have our subcommittees. Awesome. Part of what we need to do with these, kind of meetings is we want to make sure that we're putting ourselves out to the community and make sure that those communities know about them. Dave, if I wanted to make some flyers, does it make sense for me to make flyers or for someone at the commissioner's office to make flyers about these events?
Probably you make them and then we'll send them to Sarah and she'll get them up on the website and the Facebook page.
Okay, I can do that. I'm really good at flyers. All right, so action step for me. Because we would like to give out those flyers, so it would be wonderful if we could also be at events that work with these groups. So, the Broadway Reunion and the Hispanic Heritage Festival are coming up this coming month. Is anybody already planning on going to those events that might be able to represent us at a table?
I'll be there and I'll be able to help you get the table set up, but.
Okay, you're gonna be doing other things, that's fine, okay.
But you can start setting up at 3, or actually a little before 3, I would suggest.
And the same day as the Hispanic Heritage Festival, which is always fun to go back and forth. Was anybody planning on going to the Hispanic Heritage Awareness Festival that would be able to take flyers and hand them out or set up a table? That's right. What I might be able to lean on is,
Do we know what time that
I think it's from like 3 in the afternoon.
about the same time?
Yeah,
But
like from
they
3
start-
into the evening.
I know, because I meant to get over there and get some food last year, but I was having too much fun on Broadway, so I never did. And I was
See, they
like,
start about the same time, they start setting up close, they start cutting off the streets close to around 12, between 12 and 1, or 12:30 and 1, I'm sorry.
Yeah, I'm not, but I'm ready now. I could lean on some other community members as well to get our word out for us, if it's not gonna be us.
And I think I have some people that would be willing to do that.
Is that a legal thing to do? Okay. All right,
But I can go ahead and get their area secured off for them.
okay. Yeah, the Hispanic Cultural Awareness Day setup is between 3 and 3:30 on the 16th. So that is the time frame for setting up, but it does run into the evening.
Where is the Hispanic Cultural Awareness Festival at?
Oh, it's at Eggleston School,
Okay.
or Eggleston Community Center, I guess is what it's called. All right, and Lindsay from the Health Department.
On here too, you had about the listed addicts week, the
Yeah.
rally for recovery is
Mhm.
what they're planning. I'm planning to be there anyways, with Healthy Communities Initiative or something.
Okay,
I'm sorry, but
so the event on 9/14?
yes.
Okay. That was 71 minutes.
Okay.
Okay, we have Ruby Candy, and the report chat. Yeah, I think I did 6 p.m. on September 14th. The community health fair on Saturday, September 9th, is that something that we need to be at, or are we gonna wait until we start having our own initiatives? So right now, we're still building those. So wait on that one.
It seems like there's a lot of momentum.
Okay,
So that sounds like a lot for just 1 month.
okay, it is. September's big. There's a lot going on in September. The only other thing I see, was the Out of Darkness Walk, which is run by the American Foundation for Suicide Prevention. Is anybody already planning on going on to that? It's, September 23rd. 10:30 a.m. is the walk. If not,
Yes, that one I'll be in.
okay. Okay, Out of Darkness. Living everywhere. All right, very good. That's the most of it. The only other thing, when Lindsay went from the health department visited our last meeting, the county scorecard from the health department wasn't available, but that is available now. So I'll share it with DJ and he can include it in the minutes. It's a website where you can click around and see kind of how we score compared to other counties health-wise. So that we have a little more information on that, but I feel like we need even more after looking at it. So we might come up with some questions that we want to get more information on. All right. All right, I think that's all for agenda item 5. Any other business from the last meeting we need to discuss? I know there was some follow-up that Dave had with the environmental group with the herbicide stuff, so he's following up on that. Anybody have anything else from our last meeting? All right, so next, Tammy brought this to us. It was
Laurel, I can see her in the hallway back there.
So Tammy was here with Laurel, with discussion regarding the mobile sensory room for events in the county. Did either of y'all want to like talk about that a little bit? Tell us more about that project? Laurel, are you? Hi. Feel free to grab one of the chairs at the table, and if y'all want to grab chairs as well, you can sit at the table too. Okay.
So can you kind of share with the group where you're at with?
Yeah.
So,
So, I have been working with the Jefferson County Kindness Organization, within attempting to get some grants from Bethany's and, the Community Foundation for a sensory mobile vehicle. We had our last meeting, I think, with both grant committees. We're just waiting on an answer to if we'll get the money to purchase the vehicle. And then I have been working with Outward Bound. It is an autism business that serves Jefferson County and a lot of surrounding counties. They're willing to kind of partner with us and consult with us on the sensory vehicle and on some training for the county. The sensory vehicle is through Culture City, and it's a not-for-profit in Alabama, and they make the vehicles all over the country for different people. They also have a certification process that we have been working on. We have to get that certification in order to get the vehicle. So that'll be through the Kindness Group. Other businesses that want to get certified have to do that separately, through Culture City, or they can do it through like the Autism Society, or even Outward Bound potentially could do some training like that. I guess my goal is really I would love to see as many businesses and people trained. And it's an hour training at the most, and it's a short quiz. It's nothing like it's gonna take a lot of time, or even money. The certification that we are gaining through Culture City, it's $1,000 annually, but that is unlimited on how many people. So if your business has 100 people or has 10 people, it's the same price. I talked with Visit Madison, Mr. Forrester, about this venture too, and he's really interested, and he's going to talk to Culture City as well about, you know, how he can help. So I guess I would love to see the county have some sort of a training with Outward Bound. And anyone that wants to come to the training is able to, whether it's some businesses or parents that need it, or just anybody in the community.
All right, well, we as a commission advise the commissioners. We can definitely, if we want, is that something we would need to vote on to make a recommendation to the commissioners to hold some kind of event? And would it be an event that we would hold as a commission? Or that y'all would hold and that we would promote?
I mean, Outward Bound's willing to do the training. I think getting everything coordinated and promoted would be the big thing to do. And we have talked with the commissioners and the council with about the vehicle. So they're familiar with the project.
City or county or both? Okay. Okay. Did y'all want to have some discussion about what we think about recommending doing an event with the commissioners? I'm for it.
I just want to clarify, like, so the training, that we're talking about would be, you know, helping train folks on how to handle, those with autism, maybe when they become overstimulated, or things that businesses can do to help alleviate that.
I think it would be, you know, introducing them to autism and, or sensory issues and what that means, what sensory overload looks like, compared to, you know, something else, because I think people get, a little intimidated, or they just don't understand when someone may be just having a sensory overload and they just need a moment compared to something else going on. So I think it would be that. It would probably entail, you know, what services are available as well and how they can help in that moment.
So the mobile sensory room is like a vehicle that just has, it's targeted for somebody to sort of have a refuge from stimulus, is that?
Yes, it would be, so this would be a mobile unit compared to, a lot of places have like a sensory room now. But this would be a mobile unit that we could access and utilize at events. Or even, I have been consulting with Auburn University in Alabama. They have one, their nursing program, and they're taking it to football games and just having it available. So yes, it's a refuge for someone that's dysregulated and just needs a moment to kind of re-regulate and then go back to enjoying the activity. It's a tool for them to be able to utilize so they can be part of the community instead of feeling them or their families feeling like they couldn't.
And I think maybe when you first came here, you had talked to us about the sensory vehicle, not necessarily just being for those with autism, but maybe somebody with PTSD is at the fireworks and needs a moment to gather themselves.
Social anxiety, or, you know, there's a lot of different reasons it could be accessed and used. I talked to some of the people that staff it, and they said that typically it's like someone would use it for about 20 minutes. It's not a lengthy period of time that they necessarily need it. It's really just a tool to use just to re-regulate, and it's not to lounge in and hang out in for, you know, a long period of time. And then it's also a tool for us to be able to advocate and educate, because there'll be a tent set outside the vehicle with a couple of volunteers who can provide material, and they said that usually there's people curious and want to know what it is, so that's an opportunity to talk to the public about what it is and how they can help. I went to I guess part of the certification process, if you go through Culture City, is also you receive sensory toolkits or bags, and that's usually like silencing headphones, a few sensory tools, and I think some cue cards of sorts. They also, if a business is getting their certification, they do social stories for the business. They provide signage that shows that you're sensory friendly. They provide so many handbags for the sensory toolkits. And they also have an app. So this would be good for the visitors coming into Madison too, that you can download for free. Anybody can actually do that right now. It's on Culture City. It's a Culture City app, but you can download it and you can just look and see, like you can pull up Louisville and it'll show you all the sensory locations that Culture City has worked with. And then if they have a mobile unit, if they have sensory bags, if they have quiet rooms, just what they have in their business. So that's another good tool to help those that are coming in the community, just to visit even. And it's spelled with a K.
I think it's a great idea. I definitely want to see it happen, and I would love some training. I know myself, I had experience after the Hometown USA parade this year. I was in the parade and walking back to my car afterwards when I ran into a man. He was a veteran who was triggered and like approached me because he needed to be talked down. So for about a half an hour, I stood there and talked to him while he came down from being triggered, and a space like that would have made it so much easier for him. And having some training might have made it easier too. Because I was just like, whoa, stop. So yeah, I think it's a great idea. Any other feedback or anything like that?
I think just with the volume of festivals that our community has, and a lot of them can be pretty overwhelming, I could see how it would be really responsible and beneficial to have.
How is the health department related to the county? Like, what is that relationship? Are they like a county partner, or do they report to the county, or?
They're kind of, I mean, they're separate because you want the health department to run separately than the county government. I mean, there is a relationship there, but,
Budget.
they have their own budget, but right, I mean, it doesn't feed in, but they get a lot of state funding straight where the.
Okay. I was just wondering, because they would be really good at getting the word out as well, so.
Sure, you can use them, their sign would be helpful. I mean, I think we can promote it pretty easily. Getting someone in county government to coordinate, I think is gonna be difficult. We may have to be that part of the coordination effort.
Yeah,
And we, you know, I'm sure Lindsay would, if she would, or someone else would participate in it as well, just to.
so do we as a committee feel confident in being able to help coordinate and promote this event?
Yeah.
Okay. Shall we vote on it? So I guess I need to make a motion. So I move to, vote on the Health and Human Relations Commission working, with Kindness Jefferson County and Outward Bound. And sorry, remind me of your name again.
It's Laurel, it's Laurel. Wall, WAHL.
And Laurel Wall, to coordinate and promote an event, for autism awareness, and to promote training in this event that is to be determined in date and time and space. All right, Are there any?
I make a motion to.
So, you get a second.
Okay, gotta get a second. A second, okay.
Any discussion?
Any discussion?
We've had a lot already.
Okay, I did it out of order.
That's all right. That's all right. I don't think Roberts is gonna come around and
No.
tell you that, oh, you did, all right, well, there's.
All right, so we are approved because we had a second.
Well, then you take a vote.
Then we take a vote.
Yeah.
Okay,
So if people wanna put the motion forward, someone will second it. Sometimes you can make a motion and it just dies
Okay.
right there, but,
so it's been seconded.
right? All in favor?
All in favor?
Aye.
Okay,
We're
we're all approved.
You say any opposed?
Any opposed?
Right.
I'm gonna have to get like a cliff notes on this.
Roberts has got the regular one. You can use county's website and Facebook page to help promote too, so, but that's.
All right, I'm not good at Roberts, I'm great at making things happen, so we'll go with that.
Thank
All right,
you.
thanks,
Thank
Laura.
you, guys.
Yes.
Sorry, I didn't make you guys
All right, so next is our. Whew, it's getting warm in here. Community discussion on efforts for bringing a YMCA facility to Jefferson County. And before we get started, can I take a poll of like who is here for what type of topic? Or do we just need to let people stand up and say what they want to say? Okay, let's just do that. So how do we determine order? Is there any
Let's go first.
process to that? Why don't we just go around the room and we'll start on the left? Okay. Okay. Is there a group that would like to go first
George.
with a spokesperson?
So, I'm Dr. George Alcorn. I'm Vice President of the medical staff of Norton's King Stars Hospital. And Dr. Murphy, I watch him every day, take care of him. About 2 years ago, I went to the medical staff and I said, with Norton's coming in, there's gonna be money become available. And so I said, we need to step forward as physicians and promote the health of our patients and community. And I had a motion, it was approved, and so I started pursuing it. So 2 years ago, I met with the mayor, the school system, and we began a joint effort to build a YMCA-like project. It was disrupted by a change in administration. We struggled, and now we're back in place. We now have a 503C. 501C. Mary is the head of our group in terms of our Kirby but anyway, our idea was concentrate on pool. We've been working with some of the the gyms in town that are pioneers, and so they're not trying to duplicate stuff. We have YMCA involved, the Switzerland County group. We also plan to keep a tandem plan, because if YMCA is too restricted, then we want to go community. And if you look all over the state, there are community centers that people built. We also found that the YMCA at Broadway in Louisville is a community health center. It has all different types. We think the power is having, Norton's has agreed to put offices in, period. And so they've committed to that, and we are pushing them to have a wellness center. Some of the things that we're talking about here include yoga, include sensory therapy, but I don't understand that field, but we have somebody assigned to look at it. We're gonna be inclusive completely. We don't want anyone to feel excluded. We have a feasibility study planned, and we're raising money for that, and we feel we'll have that money raised. That's for the YMCA requirement, and we need anyway to get as much community involvement as we can. we see a special relationship with the school systems. The physicians really want to be more involved. Our medical staff is committed to coming over, teaching, being involved with the school system. The site we're looking at is yet to be confirmed, but the mayor wants to connect with it, with his park system. So, when I stop there, anything I left out?
I can add, where we are with the 501c3. We had, Southeastern Medical Alliance was like the auxiliary with the hospital. And we did, reach out and read for about 20 years with the different, doctors' offices and health department. And there, was kind of a lack of interest in continuing that. So, when I heard that George was working on this, I offered that we could take that 501c3, amend it, and maybe change the name and use it instead. We had done this before with Madison Youth Unlimited, which some of you are familiar with. We've used that for different projects. It started out as a skate park thing. So where we are right now is we have filed with the Secretary of State for approval of the name. And our little core group has come up with Jeffco Health Initiative. Initially, we were going to say Madison Community Health Initiative, but we want this to be Jefferson County. So that's the name, Jeffco Health Initiative, Inc. We've asked the Secretary of State to approve, and that's been submitted. We're planning on an organizational meeting on September 14th at 4:30 at the Alcorn Law Office. And the plan for that meeting is to elect officers. We have a nominating committee. We've kind of come up with some names, but anybody who's interested in serving either as an officer or heading up committees, we're going to need, I think, a lot of people, and we need the whole community to be involved in this. And I don't mean this to be in charge of it. I just mean for this to be a method, a way to apply for money, because we're a 501c3. We've talked to Bethany Legacy, and they're working with us. There's a commitment, we think, from the medical staff who will commit. The feasibility study that's required is going to cost $25,000. We have the paperwork, and I can share it with, if I didn't send it to you, Jane, I will, going through exactly what they will do, and that it would be $25,000. So Lindsay Wine, sorry. I've talked to her, and she's put in a request in her budget for $10,000 to help us with the feasibility. But the Y representatives think that the more we have grassroots support and contributions from all different areas of the community, the more successful we're likely to be to have the Y approve it. So, you know, we've got those two groups that have said that they give us a chunk of change, but we're going to be probably asking everybody else to chip in to, and you know, if we can't get the money together for a feasibility study, we really don't have, I think, any business talking about building a Y if we can't raise, because a Y is going to cost probably, I think, 20 to $30 million.
Or more.
Depending on, so we need to put committees together. They told us we should come up with wish lists of what we would like to see in the Y, what services we'd like to provide. In our group, we've discussed that we don't see really a need for a weight room at the Y because we have perfectly fine gyms in town and at the school. Yeah. So we need people who have ideas about what we need, and part of this feasibility is going to be having meetings and contacting people in the community to find out what the needs are in the community. There's no set requirements for what will be in a Y, what has to be included in a Y. So, you know, we just need to look at what's needed in the community and try to provide that. But we're looking for a community, really a community center that concentrates on health. And the director in Vivi pointed out it is physical, it's mind, body, and spirit for the Y. And even though it's wide, it's Young Men's Christian Society, it is not meant to be exclusive at all. So that's what I know about where we've gotten so far with organizing our Mary Band.
Yeah, Mary, I just wanted to mention, and Mary's been really driving force with this, but wanted to mention that the 501c3 has members, and there would be a membership fee.
Yeah.
So just make sure everybody's aware of that, but there would be a membership fee. The other thing I would add is that a lot of, as you've said, a lot of these ideas are formative at this point, not set in stone. But the facility, we did a site visit, many of us did a site visit to the Louisville facility at Broadway in 17. And it was quite illuminating. And, you know, I came up with the idea that what they have done there is basically, it's the manifestation of their vision of the community needs for health. So I think what George and the doctors have started out with, which is basically medicine 3.0, which is a new look at medicine, which is looking at trying to make sure that we are healthy or trying to approach life in a healthy way. I think is a great initiative. It's something that the community really, I think, needs and can use. And it's a type of approach to healthcare that exists in a lot of the other communities throughout our area that are growing communities. And so for Madison to get in the game, so to speak, we need to be able to step up and offer those kind of facilities to attract people from areas in upper management, education, doctors, lawyers, to show that our community has the same kind of facilities for health that other communities have throughout our state and the surrounding area.
You get two lawyers in the room.
Oh, yeah, it's trouble.
But I did want to add that we want this to be inclusive, and that is Dora's primary focus in working with us. It's that we figure out a way that we can use scholarships, so we can find some way to include people in the Y or the community center that couldn't pay like the annual fee to come in. And different Ys have done that different ways. And community centers have done it in different ways, but that is one of the primary, not a primary objective, but it's very important to everyone involved that it's inclusive.
We also need a place for healthy youth in this community. Something that's active. I mean, when my kids grew up, they went to the bowling alley. Well, the bowling alley burned down. We don't have that anymore. So, you know, an open place for swimming, open gym for basketball and playing. The YMCA offers lots of youth building activities, and it is. That's the reason I like the format of the Y. A lot of these things have already been figured out, stuff for kids to do after school, before school, that are not involved in athletics, things on the weekend.
My husband and I are new to the community.
What's your name?
Cheryl Brown. And we have lived all over Indiana, small towns, and often there was the YMCA. So we noticed the absence of that pretty quickly, especially aquatics, looking for a place that we can swim, kids can learn to swim, you can have a swim club. So that's been something that we've never experienced in all the places we've lived until we came here.
My name's Heather Laura. I work at Hanover College, but I'm here to speak just as a resident of Jefferson County. I moved out here in 1998. 25 years ago, the swimming facilities that we had were at Hanover College, at Hanover Park, Crystal Beach, Clifty Park, and schools had offered public swim time. And now we have, this past summer, have only had Clifty Park, which is only open limited hours for a couple short weeks for a summer, and that is not adequate for children and adults to learn swimming skills that are necessary for safety. That is not adequate for anybody who wants or needs a pool for their personal fitness. I think that situation is an embarrassment to the county, and I do realize that it's a significant investment to put a pool in. I think that's part of why we don't have the pools that we used to. But I think it's a very worthwhile investment in the community and its residents. So I'll put my time on the line and say I would be happy to volunteer with some of the initiatives that you're putting together to get this started.
I'm passing a sheet around, and if you put your emails down there, I'll keep you notified of the meeting, at least of our group meetings. We have to talk to the county about how, you know.
We'll talk last, so I'll go first.
Pat Cleveland, kind of the same story. We moved here 3 years ago, loved Madison. First hole we found in Madison was Breeze Swim. And the kids group, our 3 kids are now grown, but that was something they always did, right? You went to the pool and they had, you know, we were in New Albany, right? It's not that much different than Madison. Madison's a lot, has some real perks to it. But I listened to our mayor, and he says, well, the one thing we're lacking is how do we keep people here? How do we bring people here? Well, you have things like a Y or a community center. I don't care which one it is, but those are important. Those are important things for people with kids. It's important people like for us, we're retired. It'd be nice if we could go swimming, right? And yeah, the 2.5 weeks, but, or 2 months, if you guys have the pool open at the state park, that's not it, right?
I'm Kathy Cleveland. I currently belong to the Y in Louisville because that's where when we lived there, that's where I belong. And it's a bit of a drive, but, I was there today and looking out in Jeff. Vivi, I know is a little bit closer, but it's from my house, 36 minutes. The Y in Jeffersonville's 50 minutes, and there's a whole lot more to do in Jeffersonville than in Vivi, to be quite honest with you.
Yeah.
So there's even more to do in Madison.
Yeah.
And if we had a pool here, then, and I won't speak for Larry, but, we were speaking the other day and they moved here after we did. And he said, boy, if they had a Y here, we could retire here, right? This could be it. And that's the kind of thing that is gonna draw. I mean, I've talked to other friends, they said, no, music, but a Y is why people, that would really help. It's just when you check it off, when you say, I'm gonna move to this community, hey, they've got a Y or a community center, check, you know, and then Madison's got a lot of the other things already checked off, so this really helps.
The doorway.
Nathan Montoya, and the two may I speak for both? We moved here, let's see, 16 years ago, and we've lived in many places in the state, in the country, and in other countries. Every place that we've lived, there has been a full health facility. And it was maybe the one thing that we were shocked was not provided here in the community. And we're both swimmers, lap swimmers. I'm a former several lives back. I was a WSI water safety instructor and lifeguard and all of that. But we're accustomed to having a pool, all-season pool, an indoor pool with wheel lap lanes. The proposed lanes at Crystal Beach are very nice, but not terribly adequate. And so we live here and we are retiring here. And it's important not just for drawing young people or people thinking of retiring, but people that are retired here to help us extend our active years. And so we sorely miss having a facility like that. And I want to say with regard to, mentioned a while ago, there are other facilities in town that have, say, weight training and this and that. The thing is that one's retired and living on, a retired teacher's income, shall we say, and Social Security, you can only afford so many memberships. And to have something of everything in one facility, an indoor track. Hanover has a great indoor facility, a great indoor track, and there are weights, but there's no pool. In the changing rooms, in the locker rooms, there's a back door that was apparently intended to go to the pool that never happened.
I
That's what-
know where the original drawings are.
Yeah. I wouldn't go out that door, but there's nothing there except grass. And so to have everything in one facility that would serve all seasons and all people to make it affordable for all people to have access to a wide range of things. Be very important for us. We're not going anywhere because there's no why, but we would sure love to have one or something like that.
My name is Richard Warren. I'm the assistant athletic director at Hanover College. My family, we moved down here at the end of June, so it's been a quick transition with a 9-week-old. Kind of piggybacking off of what you said, I think having the weight room would be advantageous. One of the most challenging things for someone to do is to go into a gym. So if you have some big oversized grown men just grunting and dropping weights, that's gonna be intimidating. And I think, you have the silver sneakers community. I think there's so many benefits of adding that weighting component.
I think we're still in the formative stages, as I said, and I wouldn't think that was off the table.
Just a clarification on the pool, I've been to Lafayette and members have been different places, but what the physicians and Norton's, I have been talking to the vice president of Norton's that controls this hospital, are envisioning is, merging close to the school. What the mayor and the schools want is competitive lanes, in other words, 5 to 8. We saw one that was 8, and then kid pool, diving tank, and then a circular pool on a different filtration system that's warm for old people like me. And that's what the doctors see as one of the big advantages with physical therapy blend into this. And so anyway, the problem is the price tag goes way up. But, we're in conversations with the school system. We feel like they're gonna help dictate what we get, but we don't wanna undershoot what we should do. And we don't wanna go too small.
And Georgia's school system, plural.
Yeah.
We got
All
conversations.
Jefferson County school system and Hanover College needs to be talking.
We're very interested.
Especially if you have an 8-week pool.
Absolutely. Yeah, because I'm sitting here and I'm thinking, okay, it costs minimum 30 million to put together, to build, construct. What are the operating costs gonna be? If you do have a competition pool, what does that look like for having invitationals where, you could pay staff or it could, cover those operating costs? So I just want to listen because I'm kind of all over the place and everyone's got some incredible ideas and input, so.
Maybe also, as maybe in addition to sort of weights or whatever like that, there could be, and particularly for kids, sort of activity-based weight type things like a rock wall on the side, or whatever like that. So there's probably a lot of room for sort of a hybrid of weightlifting and activity that could be explored. The other thing I was gonna say, comment to the Clifty pool, and I don't know how it worked at the Y in Louisville, but it seems like Clifty pool, at this point is the only outdoor pool we have. And its entire calendar is determined by the availability and the reliability of high school students. And so, that's very limited. And so I don't know how, if I can, at a traditional facility like that, can there be like overlap of staff and that sort of thing? And, I'm guessing and I'm hoping that staffing is easier than what you see at the outdoor clipping pool.
I think, my understanding was, that the YMCA's, if we go that route, would be to, work staff back and forth. And, we think really those kinds of things are a matter of money. And the other thing is that, we're keeping open the private idea, and we have identified, the original people, contractors that were looking at the school system idea of a large pool, which I described. And we've contacted them and gotten information from them, and they run the things, you know, they basically, run. I think the idea is the powerfulness of this is that if we can, Norton's will definitely come in, but we look at a position and we don't do a very good job of mental health. We don't do a very good job of anything, having to do with that. And so we're looking at trying to maybe change the way our face is as far as mental and physical health. And we think the doctors treat more mental health than almost anybody. And they need to be front and center of trying to help guide maybe some new ideas as to how to approach that. Not just set up an appointment and do the usual routine of dealing with doctors and nurses in hospitals, but take a different approach in a different area.
We also do a poor job of prevention and longevity.
Right.
Very well.
One of the things the Ys have just kind of moved toward is a national membership. And so when we plan vacations or going somewhere, we look at where the Ys are at and we try to coordinate our trips to visit different Ys when you travel. So I think that's another attractive benefit to having a Y here.
To George's point about health and mental health, is that when we were at the Y, Broadway 17, you know, they had some counseling available in that facility. They also had some grief counseling available. They also had hospice available in that facility. So again, I think it's, you know, how creative can we be and what are our needs? You know, we need to figure out we need to define what our needs are, and then, you know, try to fashion this facility around what Jefferson County needs.
Carolyn got this list from the YMCA of Greater Indianapolis, facility amenities by location. And if you want to look at it, they have what, maybe 10 facilities?
Yeah.
And they show the different services that are offered in each of them. If you guys want that, I think that's an extra.
Will the feasibility study cover a needs assessment as well?
Yeah.
So it won't be a separate process.
I'll send you a copy of their proposal for the feasibility.
I'm Bill Barnes with the Community Foundation, and I want to start off by saying how much I admire when citizens see a need or there's a gap and they step in and want to do something about it. So I think it's wonderful that you all are going down this road. When my family and I moved here 13 years ago, I also wondered why there wasn't a Y, because the YMCA was a big deal in my life. I coached youth programs, chaired their big fundraiser to help seniors, adults, young adults, and kids who couldn't afford. So I'm all about the why. What I did see is other organizations filling in some of the roles. What I also learned when I first moved here is that when there was talk about a YMCA years ago, it didn't go so well. There were people that fought it and everyone and folks got kind of turfy about it. And so what I would ask, and I really appreciate how open-minded you all are, and that this needs assessment is gonna identify gaps and understand and sort of an inventory of the assets that are in place and all that. So I think that's fantastic. All I would just ask is that, you know, before all that formal process, that you sit down with representatives from Girls Inc. and Boys and Girls Club pretty soon if possible, just to sort of, you know,
because, I really like, you know, what I'm hearing, and again, appreciate that you guys are exploring this.
Yeah, I'm Jan Beatrice, and I'm glad Bill brought that up. I moved here with my company. I was with Cummins when they had a plant here, and so I had no choice. But then stayed after they closed the plant, and then when I retired, so I've been here 32 years, I think now. But I thought Crystal Beach was a private club when I moved here. There was no signage, no anything. It closed at 5 o'clock. When I would, you know, get home at 7:30, it was closed. When I would go on the weekends, it looked like a private club with a bunch of kids and no sign. So I never knew it was available. Then through a friend who happened to use the rehab pool at KDH, that little tiny one, they had, could hold 8 people. And you had to be on the waiting list and know somebody who knew somebody to get the secret code to be part of it. That's how I got involved in water aerobics, and then was able to finally find out it was a city pool and to convince people that we needed to do water aerobics at Crystal Beach. And I'm constantly fighting with the Parks Department to make sure we do that, and it will be part of the new Crystal Beach. And like Bill, I remember when there was talk about a Y here, and oh my God, you would have thought we were planning to blow up the town. So, thank you for all the work you're doing to bring this back. Because we do have, you know, we need healthy exercise. There's a great book about how water itself heals. And we have a river, which nobody uses unless you have money in a boat. We have had Crystal Beach that was closed a lot. So just getting people healthier with water activities. It's great on joints, it's good for old people, it's good for kids. We need to include the whole community, so thank you, any way we can help. Just been there, done that, it's a lot of work to convince people.
I'm hearing a lot of talk and people sound very interested in the pool aspect, which excites me too. I learned to swim at the YMCA in my suburb of Dallas. Small child, my daycare would bus us over there for swim lessons. So I remember that, but I also grew up, again, a larger suburb of Dallas, Texas, and where you're talking about, or maybe it's a community center. And so we have those. We had they're called the rec centers, and so there were 4 high schools in my city, and I feel like there was a rec center kind of near, you know, each one of those like neighborhoods, so to speak. And I spent a lot of time there. So there was a pool right across from the rec center that I frequented and I could walk to. But there was ping pong tables, there was classes for adults and for children. And it just felt like a very safe place for kids and youth to gather. And that is something this community, I'm also obviously a transplant. I've been here since 2009. And there's not a lot for young people and for kids that especially is healthy and good. And, you know, I shuffled my son out of here as quick as I could. You know, once he graduated high school and we knew he was going to stay with Ivy Tech, at least for the first year, and I sent him to Bloomington to go to Ivy Tech there and not sit around when he wasn't at school and just find trouble in town. So, yeah.
I want to piggyback off of that. I'm Thomas Laura, I'm a student here in Jefferson County, and like, you mentioned the shuffling your son out of the county, and that resonated with me because like a lot of the people I've talked to, like they pretty much almost all intended to move out of the county or out of the state if they didn't, you know, weren't part of the family business here. And I think just having sort of, you know, Y or a community center, whatever form it takes, like that's something that's, I would almost say, essential to
having young people stay / move here. And I know that that would make, my life and so many other lives better, like regardless of age group.
Other community members that would like to make comment? Yes.
Just wanted to ask, has anyone looked at Bloomington? I think they have 3 wives, at least in Bloomington, and it's.
It's well worth looking.
Yeah, and it's such a varied community there. It's less blue collar now than it was when we're both IU grads. But still with the students and then the town, it's quite varied, and so 3 facilities, and so the Indianapolis seat there made me think of that, looking at what they provide overall for the community might be worth a trip up or whatever. And also in Nashville, there's the Y there with a very nice indoor pool, I think it's 4 lanes or something. And we have family up in that area, and so we considered joining that Y and in order to be able to swim. But of course, then if you join there, there's one here, you'll transfer, which is a nice thing about Ys.
Any other final comments?
I've worked at the Bloomington Y and a Y in Indianapolis, and they do offer scholarships for low-income families, so we had a lot of children who were able to come at no cost.
Are we good?
I have something totally not related to swimming or the what.
That's fine.
Okay. So we.
Yeah, I think once we finish out this
Okay.
discussion, then we'll get.
Okay, yeah.
And all
Okay.
introduce that.
Okay.
Okay. So good. Sorry about that.
You're right.
All right, so if we've had all the Y community comments, I think we as a commission brought it up because we were early on making a list of issues we saw in the community. And like 2/3 of them could be covered with a YMCA. So,
And we wanted to be more active in assisting in getting a YMCA, because we also see the need. I know I'm from Madison, and growing up in Madison was wonderful. It was not like it is now for the younger people. We had Crystal Beach, we had Hanover Park, we had Clifty Falls, and then there was open basketball. It was not a big deal. The kids didn't have to go to a different gym to go weightlifting. They got to do weightlifting in their school. They didn't have to worry about getting shipped from this place to this place. The high school offered it. If you played basketball, if you wrestled, it was given. That's where you went all year round, summer, winter, spring, summer, fall. You didn't have to rely on someone else's gym, which is not fair. It's not fair for the youth, and it's not fair for the people that want to work out. That's a conflict there. And it's not fair to them, but growing up in Madison, we had the Brown Gym. We had girls softball league, women's softball league, t-ball. Then I remember when they brought soccer to Madison. No one had ever heard of a soccer ball. The parents were going down to the library and getting a VHS tape and teaching themselves soccer. And I was very fortunate that my parents were one of them that had never seen a soccer ball, but they were out there coaching. So, and we had a rolling rink. We had all night skates for kids. That's where you went. You went to all night skate. It was like the second babysitter, but a lot cheaper. Gave the kid $5. They got to eat nachos, fall asleep on the floor, and everybody's happy. And they had roller rinks. So those are things that Madison has had, and there's no reason that they can't have them. And that's one of the reasons why we brought it up, is because we would like to see those things happen again. We would like to see those facilities, and we want to be able to assist and help in every way possible. So we are here for you all. We are here to help and call on any of us. We want to come to the meetings, tell us what you need. As Jane mentioned, we are out in the public. So because we are in the public and we are very vocal, we are more than happy to board and to help get assistance, including financial assistance.
That was gonna be my question. Do you have money that you can contribute?
We as a commission do not have money.
Okay, but you could make a recommendation to the commission,
Yes.
right?
I think what would be really helpful too is if we create another subcommittee for this topic. That can like be involved in the public meetings that y'all have. To kind of keep us as a committee, informed on what's going on with this project and the process of it. But before we like put somebody on there, is there anyone else on the commission here that would like to speak to that? Or anything else about this topic? I think I've already said everything I need to about a why in this meeting, so.
So if you signed up, I will send you a notice about when our meeting is on the 14th. You know, I'll remind you when and where it is. And if you show up, we'll find a job for you.
And our subcommittee, on this topic could, if they need to, hold meetings with you outside of this space, to make official like discussion about it so that they can bring it back here and report back. So it doesn't have to be in a public meeting. So, is there anyone who would like to volunteer? I kind of would like to nominate Dr. Murphy since he's so connected to the hospital.
I can at least be a liaison.
Yeah.
Yeah,
Yeah, that's good.
yeah, I can't commit to all the meetings necessarily, but I could at least. Have George's number.
You know where it works.
Yeah.
Liaison, Dr. Murphy. So we do need to have a meeting or something like that to discuss, the. So you are the subcommittee. I can also be on all the subcommittees, so. For the year that I'm on this commission. All right, so yeah, we wanna be notified. We want more information when you have it. We're, I think, thrilled that there is a nonprofit group that is working towards making this happen and want to know how it's going and how we can help, whether it's advising the commissioners on what's going on and asking what their availability is or what is available to help with this process, whether it be through coordination, promotion. If there's money available at times, we can talk about that too, but we don't have the pocketbooks, we just have the recommendations.
I sent you an email
Okay,
with
great.
the feasibility study information and I left a hard copy, so you guys can look into it.
Great, thank you. Oh, yeah, and thank you everybody for coming, and your contributions, it's really great. Thank you so much. If you want to stick around, if there's other community comments. you're welcome to.
Thank you all.
Yeah.
Thank you.
Yes, there's only ever been like one.
Okay, so we're still we're now in the general basic, community comments. So we're done talking about the YMCA.
So once again, I've invited people to our commission's meeting. Y'all know, and I was formerly a corrections nurse. What y'all may not know is I resigned August 2nd, so I am no longer working in correctional healthcare. But I still care very much about that population of people in our county and in our state. And recently I have become aware of concerns from others about situations in our county's jail. And I just kind of want to quote us because I know the first article that Bob Demery printed about what this commission was and what we were doing is that we were supporting and developing a community that functions with equality and dignity for all of our citizens. And, the concerns I'm hearing are, things happening in the jail that don't show dignity for these citizens of our community, and that possibly violates some state codes and other things. So Sam Reynolds and Emily Forbes, did I say your last name right? Are here tonight, to kind of speak firsthand, and especially Emily, who has tried, a lot of different avenues in the last month, reaching out to sheriff and
I just want to clarify, it's very vague. Are we speaking of workers, volunteers, people that are living in the facility because of?
So I'm gonna let them talk
Okay.
and tell you what, but they have, kind of gone through various channels, including, all the way up to the state jail inspector. And I will let them both know, we don't hold any power, we don't make any decisions, but, making our group aware where we can possibly make recommendations or.
Just kind of give us some assistance when, you know, we can't do anything but call someone. You know, you can't just go knock on the jail door and say you want to talk to the sheriff. I mean, yeah, you can, but, she's talked to him a few times and it's just like, we're trying to reach every avenue we can to get some actual medical care for, you know, they are our community members. I know they messed up and they're in.
Sam, can you share with the group how you work with other county
I'm
jails?
a board member of the Jefferson House. It's a men's transitional house in downtown Madison. And my father's actually the chaplain of the Jennings County Jail. And we've tried to, we do weekend programs in the county jails and stuff throughout the state. And, you know, we've tried to get into this jail. It's a free program. We supply the food for the weekend for the inmates that are in the program and that are also not in it. It doesn't require any state funding. But we've just had a hard time getting in to our local jail. And I think it's maybe because there's a lot of neglect and things happening. Emily, she knows someone more personally that's gone through some hard things, and so she's trying to, you know, contact the right people to maybe where we can get a change. I mean, everybody deserves to have a mat. You know, if you're sleeping on concrete floors, you know, there's a man that's currently in there. He only has half of his feet. Like, I think maybe it's a diabetic thing. You know, I'm not even sure that he can walk on his own, and he's in a cell by himself and has to urinate on the floor. It's bad. No wonder the mayor's son wanted to steal a camera. He used to work there. He used to be an employee there. So I only imagine that there's just a whole lot of neglect and I don't really know what else to say.
Inmates are going in and they're being left without mats to sleep on and on the concrete floors for a better part of 2 weeks, 3 weeks. Yes.
Not given toothbrushes, like
Yeah, not given hygiene, not given toothbrushes.
shower once a week.
They're sending in grievances to get medical treatment from the nurse, and the grievances are not being addressed. Nothing is following up with the grievances for the nursing staff. Pleading from inmates inside the jail, leading to other inmates having to make a stink just to get the other inmates heard when they're needing medical attention, led to one of the inmates being well over a week of being ignored to emergency surgery on his appendix. Because he was, I mean, I'm not saying that ignoring caused the surgery, however, it could have been very dangerous had they continued to ignore.
I think the problem a lot of times too, when there's certain allegations and things of that nature, you know, things, that you guys aren't in there seeing it, but Emily had shared with me that she had a loved one in the facility and was on a video call with
Yep,
them
they're all
and was
recorded.
able to see some of these conditions in the background with people not having a mat to sleep on, that they're just have a blanket. I don't,
They have so in the background of the video, you could see, adult inmates on the ground with just a blanket and a pillow. No mat to lay on. Some of them requiring medical mats, which I assume are a different grade of a mat because of health conditions. So we're not given a mat at all. Also, I addressed these issues with our jail inspector, with our county sheriff. I reached out to the mayor, I reached out to the city chief police and the state police. The jail inspector addressed these issues with our county sheriff. The issues were not fixed. He said that his impression upon the last few months of trying to get these issues under control because they are in violation of codes. Ben Flint just comes off as if he doesn't feel like he fears higher authority. He doesn't need to make changes, is how he comes off, almost as if he's careless. My view on this, we're expecting these people to come out rehabilitated, to be positive in our society. When you're housing them in neglectful situations, especially with medical neglect, what is their medical gonna do for them when they come home? If they're on concrete every night for weeks, what does that look like for their back? For their ability to provide for their family when they come home, and us, not having more people on disability or homeless and within our community because they can't work. There are inmates down there that are not being given their medication, although the nurses approved it. Jailers aren't giving them.
There's some people taking medication that shouldn't be taking medication and overdosed just recently in a jail. Just kind of not good.
What's our means of evaluating or investigating all that?
Our means,
Verifying all this.
I mean, the commissioners can go and talk to the sheriff. Probably need a little more formal, statement to go to do that, but,
and did you say you have email, how have you contacted all
So
of them?
I emailed the mayor. I
well,
did not
I mean, but
get a
the
response.
mayor's not gonna have anything to do with it.
Because it's
It's all the county.
So I-
You need to go to the county commissioner.
I tried and they told me that the county commissioner is not over a sheriff.
Well, we can have discussions with them. We have at least some line to the sheriff, okay? The mayor's not,
Right,
I mean, it's a county jail, he's not gonna.
yeah, I'm unsure of who answered the phone, but I did call the commissioner's office and that's what I was told. But however, I did reach out, knowing that the mayor was not over, knowing that the city chief of police cannot. However, somebody with some sort of influence maybe could make an influence on Ben Flint. Just with conversation, these people are living like this daily and our animals at the animal shelter don't live this way.
And there are people in the community that are willing to be there, that are willing to bridge the gap. I know someone personally who just bought Jennings County all new, brand new white towels. Why? Because they have money and they wanted to, and every single one of those inmates had a dirty, nasty towel that they were supposed to clean off with, and there's just community members that would be there, they have a passion, just like all these people. If I knew that I should bring a posse, I could fill this room with people that care just for inmates and just for people that are lost and broken and need, some community resources. So it's not like there's money needed or this or that, it's just there needs to be the right connections made to where we can get these things taken care of, and I know we're getting a brand new facility and I would hate to go into this brand new jail with the old ways. There needs to be change, and this is a wonderful time to step in there and try to bridge the gaps of where there really needs assistance, and there's definitely community members that would be there.
And I know that the jail staffing issue is an issue upon some of the care in there. They're not able to hold staff. I'm not sure what needs to be looked into for that, but if their
So Dave-
overturn is that bad.
Is one of our
What is causing it?
commissioners. And I mean, I think we need to listen to his recommendations, so writing a formal email.
Well, just writing it down, so we have something
Writing it
that,
out.
because, you know,
And
to go in and
sending
say,
it.
well, someone said.
Right.
But,
Right.
I mean,
So
Do
you
your
mean
list.
writing something down from this group
well,
or from them?
from them to make a kind of a statement on what they've seen, and then we don't have authority over the sheriff, but we can talk to the sheriff.
Can
And
somebody do a walkthrough? And I say this because I have spoke to the sheriff myself. His comments were not very productive. Other than we're moving to a new jail and then it'll be better. The jail inspector himself, the state jail inspector, has addressed these issues. And he'll tell the jail inspector, I'm making these changes. At one point, he said he sent someone to the new facility to bring down mats for the inmates. A week and a half later, I'm on a video visit and people are still on the floor. So he can say one thing, but that does not mean that it's being addressed and nobody is following up and no one's above him to follow up. These people are still living this way.
It may be helpful to, if you've seen on video, the condition to get a screenshot of it.
You're not allowed to screenshot video recordings.
Dang, never mind.
You'll lose your visits.
Wow.
But they're recorded and I made sure that I stated that with the jail inspector and the day of our visit. But the ones that are on the floor, they're in a day room, so it's a room set up with the tables. They eat there, they hang out there all day unless they're in their cell. People are stepping over these people on the floor. How are they supposed to rest? I mean, it's good enough sleeping on concrete and then you add to it, you're in the day room. And then when the cells lock at night, they have no toilet in the day room. They're
So-
urinating in the showers.
So we're hearing all this. I think what Dave's point is, we need some kind of formal, what do you need?
I mean, just write down what you're saying here.
Yeah, maybe,
And then let us-
maybe present a written, list of complaints
I have an
this-
email that I can
that
forward.
this group can recommend that the commissioners talk to the sheriff about and at least give them an opportunity to respond and.
How much longer is it until they move to the newer facility? And what is it that's changed?
Okay, so since the changing that he described to me was basically they've got their newer equipment there. Another issue that we went through is trust fund money not being utilized correctly or refunded. Inmate accounts were being charged for things they weren't wearing. And I've been addressing them since August 2nd to no avail, no refund.
Well, okay, the person got fired, okay, so.
Well, that was not ever my complaint, and I had been complaining since August 2nd, had somebody taken me seriously, who would not have proceeded until the middle of August.
And I do want to interrupt there too, just, I mean, there's gotta be somebody that you can get heard from, I don't know who that is. Our commission, our focus, health and human relations, so equity in healthcare and how humans are treated and that they not be discriminated against in our community and so I don't know about the financial thing, but as far as you know, we recognize, I believe, as a group that these are members of our community and though they may be living somewhere else, they will likely be rejoining and staying in our community. But nonetheless, while they are there, they have their basic health care and human needs met, right? So
yeah, it's basically compose your email with everything you said. since it's not gonna be coming from us, you can put the financial complaints in there as well. And direct it to the county commissioners. Dave, could you share the, email, and are the other commissioners on there as well?
Well, if you can get it to me and I'll get it to
Okay.
the other
Great.
two. And then,
Cause it's,
And though you can't take photos, it's kind of like anything else. If you can put a time and a date. This is what time I spoke to this person. This is what the date that I spoke to this person. If you can put time and dates for things, whatever your memory can give you. You know, there was a flower growing on the side of the tree. I can't think of anything, but if you can time and date it, because that's the thing that's taking a photo.
Right.
And when it boils down to it, it doesn't matter what the person has done, they're still human.
That's right.
And we want to help, we just, but, of course, like they said, we have to take the proper steps, but, just know that that's something that we would want to do.
How often does the jail inspector follow back up?
That I'm not sure.
Okay.
I know that I've spoke to the jail inspector a few times, and I will say he's very nice, very informative. And each time that I spoke to him, he immediately addressed the situation with conversation. I'm not sure how often he does a walkthrough though.
There's probably not much like disciplinary action, like if things aren't, it's not like you can be like, well, set them free. You can't house them properly, so you can't really do that either. So I just don't imagine there's much of a repercussion. There's probably not many fines. You'd be paying probably back somebody that paid you. So I don't know how that would really work, but I just know that like we could get in there and kind of just ruffle some feathers and get, change before we move to this new place. And, see if we can be there.
Let them know that the right people are watching more than anything. Like, hey, you're being seen and what you're doing has accountability to it.
And each time you speak to someone, if you change the thing, you put down today, August. Last day. I came to the meeting and I spoke at this many people, this really spoke it out. September the 1st, I called so-and-so, this is our conversation, because you can't rely on your memory. Because then it's just more of a hearsay. So that you can get, and so that also, so that people like that, who would be able to advise you. And you can say, I did have that conversation, I did not mention this. I won't do that next.
Right.
I mean, the sheriff may still not pay attention to us, but it will carry more weight if it comes from the commission. So, you will be getting new stuff. I mean, some of their, I don't know, all of their specific policies. I know they have said they're not gonna let, during the day, the inmates will not be in their cells. They're gonna be out in the day room. So maybe right now it's their mats are in their cells, but out in the day room, they're not allowed to bring them out. So while people are laying down out there, they're just, you leave people in the cell by themselves or some other guy, then problems occur. And so they said, we're not gonna go there. We're just gonna keep them out in the day room. So I don't know if he'll come back with an explanation. Maybe that will be it. Maybe he will say, we just don't have enough. And then
He had addressed with me that one, they didn't have enough because there are inmates that tear up mats. Two, they are well overcrowded.
yeah, and that's why there's the new one, and it's, well, I can't put a date out there, it's close.
November was last
2 weeks.
I heard.
Well, sure, that's a construction next month should be finished. And then it's, all right, training and getting, so.
Coordination,
Yeah.
moving a whole bunch of bodies.
I mean, it's nice, the Department of Corrections has provided, will provide a bus for us to move the inmates, so that will help in the logistic of it, that's for sure.
well, thank you for sharing and making us aware. Definitely follow up if you have further concerns.
You have that email,
Yeah.
Send it to me and I can get it to the other two. My number's on there too, so if you wanna call and talk about things, I understand about not being able to get in because it is overcrowded. I mean, you know, it's sized for 109 people and,
There's 199.
well, I don't know, in there.
Yesterday there was.
What, in the facility or
That's the roster, but we pay other counties.
yeah, there's a number that have been sent to other counties because we are so crowded. So it's probably in the 150 range for sure, so, but, since, you know, I mean, unfortunately, the new jail wasn't finished like that,
Right.
but,
Like as of right now, and I don't know how any of it works, I've never been incarcerated, so there are DOC sentenced inmates that are they've already been sentenced. They need to go to a DOC facility. If we are that overcrowded and it's causing such neglect, why are they not transporting them to a DOC facility?
the DOC won't take them right now. I mean, it's not, we don't hang on to guys if we can move them, so. DOC question.
Right.
And I do know that from my experience, that if we wait on a call, DOC gives us a date. And I know at times when I was there, or when I've even been at other facilities, a jail might give up a date. We never did, or they never did when I worked there. But because it was a holiday, well, we're not gonna have any transfer officers. And then we might get word of that and say, we heard, example, Jennings County isn't gonna be able to transfer on that date, but we've got people we can transfer. So, but it's all at the mercy of DOC saying, here's your go ahead.
Okay, well, I asked that because.
From my experience. Now, of course, I've never actually worked for the county or for the jail system.
Right.
I worked for healthcare companies that were contracted by the county to be in the jails. But here, why?
Yeah, I just asked because the inmate that I was making complaints on behalf was incarcerated downtown, and the moment that I started complaining was transported out. However, other DOC inmates that have been there for months and months and months, already sentenced, are still not being transported out. So it was almost an effort to get me to be quiet, is what I feel.
Add it to the email. Yeah, I mean, like, bullet it out, give all the different things going on so that they can sort through it and try to make sense of it and check things off with the sheriff. I think that's the way to go. Do you feel like you fully expressed yourselves?
Yes.
Okay, great.
Thanks for being
Thank you
here.
for
Thank you.
sharing.
Thanks for having us.
Yeah.
Yes.
And thanks for the
being
long meeting.
And you lead the board well.
I'm trying. I gotta
I will absolutely send them.
Yeah. We'll start.
And keep following up.
Start.
All right. Thank you.
Thank you. All right, so, number 9, because there's no more community here. Review action items, it's pretty straightforward. Dave's gonna follow up about the jail concerns and share that with the other commissioners. Cammie, myself, and DJ are gonna be advertising for the BIPOC community event, listening session. Amanda and I will be heading up the LGBTQI plus group. I will be reaching out to PFLAG and different groups about that date. So I don't think they're having events other than maybe a Rainbow River Club meeting and
They'll probably be at Chautauqua.
Oh, yeah.
They were last year.
Okay. We can find them there. We'll reach out to Hanover College students and do stuff like that. So basically, following up on listening sessions to get the word out. Dave, if we need tables for events, where we're trying to get the word out about these sessions, are there county tables that we could borrow?
I'll have to check if there are some.
Dave's gonna check on county tables.
And then I forgot something
Okay.
way up in the meeting.
Okay.
Because we had a community member that came to our
like 2 meetings ago, and she was talking about the oversprayage.
Yes.
Oh, she was here? Okay. Well, I wanted to follow up because I drive 56 every day, and between Marysville and Chelsea, if you watch as you're driving, it's all sprayed too. Like,
Oh, is it the Flatwoods Preserve?
yeah, the
Yeah.
Flatwoods Preserve, but it's
Yeah.
like sprayed all
Well,
along the
on
state
50
highway.
You know, on 56, that's the state. I mean, we can talk to
Okay.
the state once we.
What they
Okay.
spray? They're spraying the road?
Herbicide.
But it looks just like she was talking about, but it's like halfway up the trees, it's brown. Like if you're watching, it looks the exact same as the state preserve. So I didn't know if that's a correlation.
Yeah, she shared some photos, and Dave's working on following up with her and the environmental nonprofit that they're working with that actually owns the Flatwoods Preserve land. To try to figure out the best ways to move forward. They're talking also with LG&E,
Okay.
who also sprayed where the power lines are on that property. So things are moving forward with it. I briefly mentioned it, just that Dave's been in conversation with them, because that's not, we can recommend that they can work on that, but we can't do the things and make the changes, so they're working on it.
Awesome, thank you.
Yes. Did you have another action point or anything?
No, I was gonna motion to adjourn.
The only other one thing, the next meeting is September 28th. 6 p.m., then October 26th, then November 30th, and tentatively December 28th, if anyone is here. Around Christmas. So I just wanted to mention that. I think that's all the action. So yeah, I will move for adjourn.
I second that.
And just a second, and we are done.